We are stronger as a system.
We are stronger
because of our team members.
We are stronger because of our diversity.
We are stronger.
Stronger.
Stronger for our patients.
Having employees like Rindy makes community stronger by the fact that they come bringing the best versions of themselves every day. And that is a contagious attitude. So it's not just our department in rehab, but also in the perioperative services and the surgical teams that she has her impact on as well.
In my job as a physical therapist, I help people become more mobile again after being immobile. After physical therapy school, then I've been with every unit, Fresno Heart, Community Downtown, Outpatient, Cork, Clovis Community, and being in all of those different situations has helped me be a very rounded person. I can see from all angles. I think it gives me insight to a lot of different parts of the patient or the person as a whole.
Having great employees like Tracy makes community stronger because it builds up the community, because that's who we're here to care for. We like to say she's a great collaborator. Yes, she works very well with our palliative department to make sure our patients are comfortable. She reaches out to the doctors to bridge that gap between the patients and the physicians so that their plan of care is well-fitting for the patients.
My job, I feel, is very important because we are the first people that the patients see when they come into the hospital. We work with the operating room, with the physicians, the nurses in the operating room, work with the recovery room. We're providing constant information and feedback and reporting to each other so that we can have better patient care and better patient safety too as well.
Matt has been very instrumental in developing our emergency department pharmacy service line. In that role, he's been very collaborative and has worked very closely with his colleagues in doing so.
As part of my role in the emergency department, I'll work with nurses and doctors, provide them drug information, attend those emergency responses, prepare medication at bedside, and really optimize the dosing of our medications. It can often feel like we're making little changes, but making sure that we get the right antibiotic and the right dose can make all the difference in the patient's recovery.
So my role as a physical therapist in the hospital is helping patients get moving early on in their hospital course, making sure that they're safely getting up out of the bed or moving as safe as possible, and helping the team with making recommendations for while they're here on what's the safest way for them to move. We have to communicate with all sorts of different disciplines. In the ICU, we do something called interdisciplinary rounds, where we round with a whole bunch of ancillary services. The teamwork and the communication is so key, and we really try to promote that because our whole goal is patient safety, safe movement throughout the hospital. So being able to keep those communication channels open with the providers is super important.
Probably 75 to 80% of every patient that's in our hospital need to have lab tests to diagnose and help treat that patient. So we're the scientists behind the tube.
I help assist the clinical laboratory scientists. I answer phone calls, I issue blood, I get all the products ready. I maintain and make sure there's no wastage of products. They're very precious and we treat them like gold. What's most important is saving people's lives. I just care about the patient and their family.
Paul has been instrumental in developing the ICU pharmacy model. And as a colleague, he's served as a preceptor, not just to students, but even to his fellow pharmacists.
It's always nice to be able to look forward to coming to work, and I do every day, just to be able to work with different providers, different parts of the medical team, and just to optimize patient care and give patients the best therapy that we can. That's what I would say is the best part of my job.